Good afternoon, everybody. David Johnson here from the Functional Movement Training Centre and City to Coast Neurosurgery. I've got my assistant today, Elsie Bones, ready to help out. What are we going to talk about? We're going to talk about something called adjacent segment disease. Okay, adjacent segment disease. And it's not really a disease, it's a condition that happens to people when they experience back pain again some period of time after having had a lumbar fusion. So what I've got here to help explain adjacent segment disease is a spine model, and it has a lumbar fusion implanted into the model, and you can see there it has pedicle screws which are running down into the vertebral body. It has a rod that spans those two motion segments. In this case it's spanning L4-5 and L5-S1, and in between the vertebral bodies you can see there's implants that facilitate the bone graft to fuse the adjacent bones. Okay, and adjacent segment disease, as I've listed here, really means that in most cases above the fusion, the next door neighbour above the fusion undergoes structural changes that then lead on to create further back pain. So patients may experience benefit from their lumbar fusion, and then a few years later they get back pain again, and they'll see a surgeon and they'll go, "Oh, you've got adjacent segment disease. I need to extend the fusion and to now encompass the next door neighbour motion segment." So this fusion could then now be extended to include L3, but previously L3 was not fused. And so I've seen a few patients this week that have had exactly that problem, where they've had multiple operations, and it's not uncommon for people to say, you know, I had one surgery, then 5 years later I had another surgery because my pain came back, and then a few years after that I had another surgery. And then even after multiple surgeries, it's diminishing returns and they still are in a lot of pain. So what the topic of discussion today is really this adjacent segment disease, and how it actually represents a little bit of a misconception, and also how it is entirely preventable if the surgeon takes responsibility for understanding where the deficiencies are in the existing forms of rehabilitation. That if we implement effective rehabilitation after a lumbar fusion, we can absolutely prevent the development of adjacent segment disease. So let's have a little look at another spine model here, and think about what would be happening to this spine if we did a lumbar fusion. So just imagine there's our fusion rods, and we're popping them in here across the base of the lumbar spine, and then the patient goes on to participate in their normal daily activities, and they're not really taught how to move proficiently. So they go and they bend, you know, thousands of times a day, hundreds of thousands of times per year, and all in all they're bending their spine like this. Okay, so just remembering they've got the fusion here and they're bending like this, doing all those trivial tasks, tasks such as, you know, getting out of a chair, putting on their shoes, picking up the laundry, putting things in the dishwashers, you know, opening cupboards, bending forward to shake someone's hand. Trivial, innocuous tasks. But because they've got this fusion here, they're now rotating through the motion segment. That's what we call each segment of the spine, a motion segment. They've got this fusion here, and they're now loading up, biomechanically loading up that part of the spine next door or above the fusion. So it doesn't take too much logic to conceptualize that segment of the spine is going to break down. And if we have a breakdown in that segment structurally, can that become painful? Of course it can become painful. And so therefore, you can see why, going back to the surgeon, he'll say, you need to have your fusion extended. Okay? Well, how can we prevent that? Well, what we can do is understand what we do here at the Functional Movement Training Centre to eliminate that problem, and that is restore functional movement proficiency to every patient, whether they've had spinal surgery or not. And so what we want to do with patients is retrain their nervous system to move their spine in a way that does not create biomechanical stress in those motion segments, regardless of whether you've had a fusion. So now, if we reproduce that model and imagine that the fusion has occurred, and we retrain the person to move like this in this neutral spine position, you can see how it's unlikely that over the course of the rest of their life that biomechanical stress will occur at that adjacent segment. Okay, so by fixing up the functional movement deficits in the person, we can prevent the secondary structural breakdown, and that is how we prevent adjacent segment disease. So let's have a look at that in bones in Elsie. So let's have a look at Elsie picking up a TV remote off the coffee table. There she is. And if we can train people to move their bodies like Elsie here, which is entirely feasible with the Functional Movement Training Centre's NeuroHab program. Okay, boom, there we go. We're picking things up, and if we can train people to eliminate the functional disease that causes back pain symptoms, if we can eliminate movement dysfunction, we can eliminate the secondary structural breakdown. Because back pain is primarily a functional disease. The first thing to go wrong is functionality, functional movement proficiency, and the second thing to go wrong is structural changes to the spine. And if you ignore the functional deficits, then inevitably as time passes, you will develop, without a doubt, structural changes that may then require surgery. If you eliminate the functional deficits in time, you can prevent the onset of the structural changes, and therefore never ever require surgery on your spine or other parts of your musculoskeletal system for that matter, for the 100 years that we are on this planet. So I hope that makes sense to you. Thanks, Elsie. Elsie's been very helpful, and I'll see you next time. Thanks so much.